Good afternoon, respected faculty and my fellow colleagues. Today I, Bishakha, stand here to present the clinical versus medicolegal autopsy. Now, autopsy is derived from the Greek words autos, meaning self, and opsy, meaning to see or to view. Now, autopsy has been around since time immemorial. Starting from 3000 BC in ancient Egypt or Babylon, it was more for a religious purpose than for medical purposes. Antonio Benvieni, who was the first one to publish on this topic, and following which Andreas Vesalius, who worked on pathological anatomy of aortic aneurysms, and thus his meticulous anatomical dissections regarded him as the father of pathological anatomy. Following this, Giovanni Morgagni, he was the first to correlate the clinical symptoms of pathological lesions. He published his findings of over 700 findings, and then he carried on with his student Mary Bishakha, who identified 21 subtypes of physicochemical means without microscopy, all by the help of autopsy means. Following this, Carl von Rokitansky, who is regarded as the father of modern-day autopsy, he implemented the basis of each organ examination, and thus he progressed pathology, leading on with his colleague Virchow, who extended pathology to a cellular level. In India, the first medico-legal autopsy was conducted on 28th of August 1693. Then Bengal Medical College, currently known as Calcutta Medical College, here Professor Alan Webb, he published Pathologica Indica, which was a compilation of all of his autopsy findings. And following the establishment of the Coroner's Act in 1871, the first clinical autopsy was conducted here at Grant Government Medical College. So autopsy practices, as we discuss now, it peaked around the 20th century, following which there was a sharp decline in autopsy, which can be primarily attributed to the development of diagnostic and ancillary tests, which made diagnosis much less invasive and accessible to all. However, today we shall see why it is still relevant and what all are its factors. Autopsy primarily are of two types: the medico-legal autopsy, which is also called the forensic or the coroner's autopsy, and the clinical, medical or pathological autopsy, which we are dealing with on day-to-day basis. Now, medico-legal autopsy is ordered by law, and it is in cases where there may be a violent sudden death or where there may be a foul play or suspicion. And clinical autopsy is primarily done to search the cause of death or to confirm a cause of death. Before I move further, I shall touch upon the definitions of death. Now, the cause of death: any disease or injury which sets in motion the physiological train of events leading to cerebral and cardiac silence. For example, pulmonary edema, it is the cause of death. Carcinoma of pancreas is an underlying cause of death. After this, manner of death. It can be natural, accidental, suicidal, or homicidal. Natural, as the name suggests, it is due to the disease process and it is unintentional. Accidental, again, it is unintentional and it is either going to cause the death or it is going to contribute to the death. And suicide, it is the harm, intentional harm by oneself on oneself. Homicide, death at the hands of other with the intention of harm. This classification is important because here we will know where a pathologist is required and where a forensic autopsy is required. Mechanism of death. Now, any physiological derangement which is set in motion by the cause of death, which leads to the cessation of cellular activity. For example, ventricular fibrillation, acute respiratory distress syndrome, and cerebral edema. All of these are mechanisms of death. Now, why was all of this important? Here we have a form number 4, the medical certificate of cause of death, where we deal with 3 aspects. 1A, which is the immediate cause of death, temporally as well. Immediate cause of death, the disease or injury or complication which caused it, and not the mode of dying, such as heart failure is not going to be mentioned in 1A. Now 1B, again temporally, which is coming later on, it is the morbid condition which, if any, is giving rise to the above cause. And 2C is any significant condition which contributes to death, but it is not related to the disease directly. Here we shall see an example. For example, in a case of a 47-year-old man with a history of CAD since 7 years, history of hypertension and diabetes since 15 years, suffered a myocardial infarction 24 hours back. Here 1A, we'll have myocardial infarction. 1B, we'll have coronary artery disease, and 2C will be diabetes and hypertension, which contributed to the death but was not related to the cause of death. Now, the basic requirements for any sort of autopsy, be it medical, legal, or clinical, are more or less the same. It should be basically performed within 24 hours ideally. It should be in a well-lit room Meeting the biosafety requirements. This is especially true in times of COVID, where a BSL level 3 is a must because of the aerosol generation of the microbes. Then there should be ample storage areas and storage spaces for the preservation of viscera. There should be stainless steel autopsy tables having raised edges so that there is a prevention of spillage, and a sink should be attached with the stainless steel autopsy table. There should be instruments available and weighing scale to weigh the organs.
For weighing the organs, you have to separate the organs.
Yes, I'll come to that. Now the steps in autopsy. The preliminary steps, again, the valid written consent is very important for a clinical autopsy, whereas a legal requisition is important in cases of medico-legal autopsy. Complete medical records or any sort of records of the deceased is essential, and we need to consult a treating physician. And thorough documentation of all the details has to be very systematic and sequential. Following this examination, again, sequentially, external, following the incisions, in situ examinations and systemic examination, then investigations where we are going to collect the samples or the viscera. We're going to fix the viscera, send the representative for histopathological studies, and finally there will be closure of body. Now we shall deal with what is the purpose of a clinical autopsy per se. Why are we doing it? The purpose of clinical autopsy is to either confirm the cause of death in case the clinician has any doubt, or in case there is a cause of death is not given, we shall give the cause of death. And again, for medical research. Now the agreement of the prosector's diagnosis with the clinician's diagnosis. Here we will see that there's a quality, if it is agreeing, it is a marker of the quality assurance of the hospital services. However, in case the prosector's diagnosis does not meet with the clinician's diagnosis, that also is essential. Why? Because here we can have a continued educational program to see what went wrong, how it went wrong, and how can it be prevented in future. This is a very important aspect which needs to be emphasized upon in today's scenario.
How do you do that in the
Ma'am, actually, ideally, there should be a clinico-pathological meeting where after every autopsy, all the concerned departments are called upon and we give our own findings as to what should have been going. In terms of research and academic advancement, clinical autopsy offers the chance to build tissue reservoirs. Now, this is very important in cases of neurological and cardiological studies where majority of the diagnosis is generally non-invasive or radiologically dependent. So majority of the findings, that pathological findings that we get is through autopsy studies. An example of this is ALS Forum, which is a worldwide network for human brain banks. And in our country, we've got a brain bank at NIMHANS, National Institute of Mental Health and Neurosciences in Bengaluru. Then we come to the fetal autopsies, which is a very important upcoming part as well. It has been there since previously, but now with the upcoming molecular genetics, it has a very important role. Why? Because majority of the fetal, neonatal or stillborn deaths which occur are due to chromosomal abnormalities. All of these are generally detected antenatally through radiological scans or through amniotic fluid assessment. However, we can study the chromosomal analysis and genetic studies through molecular basis only after performing an autopsy. This will definitely help in prospective counseling of the parents so that the future progeny do not get affected by the same. Then again, this can be extrapolated to adults as well. For instance, if a family, there's a incidence of familial hyperlipidemia, but the family does not know about it, and a close family member dies of it, if we perform certain molecular genetic studies, we can inform and intimate the family that, okay, this is there, and they can take preventive steps for the rest of the family members. Then coming to epidemiological aspect, where the mortality statistics can be developed through autopsy studies. There are two very important ratios, that is the maternal mortality ratio and neonatal mortality ratio play a role, because the country's healthcare indicator are these two ratios. Finally, documentation of any information for future medical, legal or financial evaluation, example in insurance claims, can be derived from a clinical autopsy per se. Now, there are certain prerequisites for a clinical autopsy. A requisition from the concerned clinician mentioning what is the specific dilemma is required for a better clinico-pathological correlation so that we can focus the autopsy on the same. a written informed consent from the next of kin, detailed clinical records as I mentioned earlier, and collection of specimens. Now I shall emphasize on the consent for autopsy because this is a very essential step for all of us. A written informed consent signed by the next of kin in the presence of a hospital administrator with the proper date and time, which is of the date and time of the death and of conducting the autopsy. Then another aspect is the extent of the autopsy, which is demanded by the physician and which is agreed upon by the relative. Here, the line gets drawn whether it's going to be a complete autopsy or whether it is going to be an incomplete one. Another clause, a partial autopsy. Now, after a restricted autopsy, if we still do not find a cause of death, we can convert it into a complete autopsy. Now, we can conduct a clinical autopsy. Any postgraduate degree holder in the study of pathology, any postgraduate trainee under the supervision of a senior faculty can conduct a clinical autopsy. I shall just briefly touch upon the aspects of conduction of an autopsy. External examination. Here we shall identify the body at first, whether it is of the same patient as given on the paper. Examine the external surfaces, the clothes, the nails, the hair. Then confirm the general examination findings as given on the paper of the patient and as observed by us. Again, all of these should be systematically recorded. Any incisions, any previous scar has to be noted, and all the evidence should be photographed. Body build, height, then certain postmortem changes which indicate the time since death, that is your rigor mortis, livor mortis, and algor mortis. Then any skin changes which may indicate the mode of dying or the disease, like the pallor, cyanosis, icterus, sallow skin, or whitish deposition, or any pigmentation, hyper or hypopigmentation. Following which, we go into the preliminary position where the body is first placed supine with a block under the shoulder for the neck extension. We can have an I-shaped incision, which is the most common one, from the chin to the symphysis pubis. A T-shaped incision starting from the tip of the shoulder, meeting at the sternal angle, again extending to the symphysis, going laterally on the left of the umbilicus. A Y-shaped incision starting 1 centimeter behind the external atrium meatus, laterally along the neck, meeting again at the sternal angle and going below to the symphysis. Here we can see the various incisions. Then in situ examination, where we shall be visualizing all the body cavities, starting from the cranial, pericardial, thoracic, and abdominal cavity. Now, examination of the cranial cavity. First, the skull cap is removed. The external surface and the inner surface of the skull, external surface of the dura is examined. Any signs of bleeding is examined for, which may be extradural, subdural, subarachnoid, or superior sagittal sinus thrombosis. Examination of the leptomeninges is undertaken and the superior surface of the brain. Then pericardial cavity is seen for the position of the heart, the size and layers of the pericardium, any pericardial fluid, position of the apex, and the pulmonary artery is seen for any embolus, petition and hemorrhage is noted, and any aneurysm or metastasis is checked for. The pleural cavity is seen for any transudative, exudative, or hemorrhagic effusion. The in situ examination of the lungs for any collapse or any signs of tuberculosis or other changes, and the diaphragm is checked for any congenital deficits. Abdominal cavity, here again, the fluid is noted at the first incision, the character of the fluid, any bleeding, the in situ examination of all the organs, then the size of the liver span, the spleen, then any nodules, any peritoneal nodules present, any mucinous surfaces, or any omental rigidity. Now we come to the techniques of evisceration, that is removal of the organs. Here there are 4 methods. The en masse or the Letulle method, where all the organs are removed as a single organ block, which is best for pathology which is suspected to be passing below the diaphragm. And even in neonatal autopsies, we can perform a Letulle method. Then Virchow's method, which is where all the organs are removed one after the other, and it is the most common method performed. Following which, Rokitansky method, where an in situ dissection is combined with the removal of the organ blocks, and Gon's method, where an en bloc removal of organ occurs according to their system. Now, the specimen collection, where the fluids are sent for routine microscopy, cytology, biochemistry, or microbiological tests, and histopathology is conducted over the specimens of the representative areas. Now, although all autopsy should be taken care of, should be performed with care and vigilance, but certain situations require extra vigilance from our side, like pediatric deaths, maternal deaths, sudden death of an apparently healthy individual, or confirmation of a doubtful diagnosis. Now, pediatric deaths, as I have emphasized upon before, this is important because again, pediatric and maternal deaths, both of these form a very important healthcare indicator for our country. So, all the autopsies of fetus, neonate, infant, and child all have to be performed very meticulously and systematically, and everything has to be recorded because in our case, we all our autopsies, although we are conducting a clinical autopsy, any day it can be converted into a medico-legal autopsy. Then maternal death, which is by definition a death occurring during pregnancy or within 42 days of childbirth or of an abortion for any cause related to or aggravated by pregnancy or its management. Again, as it is an important assessor of the quality of healthcare offered. These are the direct, indirect, and coincidental causes of maternal mortality. Now I move on to medico-legal autopsy per se. It is a type of autopsy which is carried out upon the dead body in accordance with the laws of the state. Now, this autopsy generates evidentiary information which is used to form opinions in trials, any civil suit, any death suit, or any wrongful medical negligence claims. Now, what are the objectives of conducting a medico-legal autopsy? It is to determine the cause of death, the manner of death, circumstances, and then the estimation of the time since death. Because here, many times the body comes in a very mutilated form, and we cannot know either the identity of the body or when the death had occurred. All the after the establishment of the identity, all the things should be documented for criminal identification. Relevant samples need to be sent to forensic labs, like the Central Forensic Laboratory, for analysis. And in case of newborns, the issue of live birth and viability is taken care of. Now, here the prerequisites differ in the case that it is undertaken only after a written order or an inquest is received from an appropriate legal authority. Now, who is an appropriate legal authority? A police officer not below the rank of a police sub-inspector, the executive magistrate, head constable in the periphery, and it is performed only at an authorized government center. It is occasionally we need to conduct the autopsy at the site of the crime, as due to advanced stages of putrefaction, it may become difficult to transport the body. And sometimes there may be some legal implications due to which we cannot transport the body back to our facilities. Now, who can conduct a forensic autopsy? Apart from our forensic residents, all registered medical practitioners in government service are authorized. Now, furthermore, the requirements for a medical legal autopsy, again, the requisition, inquest report, dead body challan, detailed hospital records, or any paper which can guide the postmortem. And another important aspect, no unauthorized individuals or any police official is allowed inside the mortuary during the process of autopsy, so as not to influence the autopsy finding, not to bias the prosector. Now, identification of the dead body. Here, it is a very important challenge that the forensic people face because the processes of death may lead to mutilation. Now, this needs to be always done before the doctor by the police constable before the procedure is commenced. Photographic evidence of the unknown body where it is not established has to be taken. And in cases of decomposed body, we need to preserve the skin over the palms and the fingers. Then if it is possible, then dissect the terminal phalanx of each finger and preserve it in 10% formalin. Now, chain of evidence. Here, a meticulous record keeping by temporal sequence. That is, when was the body discovered? In what condition was it discovered? When did it reach the hospital? And who all were involved and at what time were they involved? Proper record keeping is very essential for the same. Now, the visiting of the scene of crime before starting the autopsy is essential because we need to gather all the evidence which may indicate what might have actually happened. Medical legal exhibits and toxicology specimens are labeled, packed and sealed and handed over to the forensic science laboratory via the police. And in case of any custodial deaths, according to the National Human Rights Commission, a video recording has to be undertaken. Now, there are some exceptional scenarios in forensic autopsy, for instance, which require the expertise of more than one or more prosecutors. Example, in dowry deaths, or in case of alleged medical negligence, where by law it is mandated that we have a panel of doctors. Now, these are certain laws related to forensic postmortem. There's a Criminal Proceedings Code 1973 deals with the procedure of investigation and trial of offences. CRPC 174, the police inquiry into suicide, and CRPC 176, where the inquiry of the magistrate into the cause of death, be it custodial or natural death, is required. Now, in forensic, a concept called second autopsy exists, where a re-postmortem or exhumation of an already autopsied body occurs. Why is it undertaken? Where there may be an inexperience of the prosector, there may be misinterpretation of the facts, improper sample preservation, improper wording of the cause of death, or the people may not have a faith in the investigating agency. And this must always be done by the magistrate's inquest or by court order. Disadvantages in clearing the suspicion regarding the circumstances and the cause of death. Finally, we summarize the differences between clinical and medical legal autopsies. Here, the clinical autopsy is a pathological or academic autopsy. Forensic one is a postmortem or the coronal autopsy. Consent, again, I'm harping upon that because it's a very important factor for all of us. Consent from the relatives is important in clinical autopsy, whereas in medical legal autopsy, consent of relative is not required. Now, clinical autopsy is always undertaken by the hospital or the treating physician's request, whereas a medical legal autopsy is conducted upon court order or anything where there may be a foul play suspected. Again, qualification of postgraduate degree holder in pathology. Here, any RMP can be performing it. Now, processing of the sample is done in the hospital itself for clinical autopsies, whereas for forensic autopsies, it is sent to the Central Forensic Laboratory for toxicological studies. The procedure in a clinical autopsy can be a complete one or can be an incomplete one or a partial autopsy, which can be, again, reconverted into a complete one if there is no cause of death given. And here, it is always a complete autopsy. These are my references.